How is the all emergency?
With its ever-looming earthquakes,
Infrastructure has collapsed.
relentless fire seasons, and increasingly unreliable power supply, the Bay Area subjects its hospitals to a constant threat of being cut off from each other.
The Bay Area Hospitals Net is a communications network that connects dozens of clinics, public health departments, emergency operations centers, and the California Department of Public Health.
And it does so with radio technology that doesn't rely on the power or communications grids. For 30 years, it's been a backstop against medical resources being out of touch in a disaster.
It runs when everything else goes south.
Go ahead, copy your third American 4.
The communication of last resort.
One of the big lessons that the emergency management and public safety community learns after any activation is the importance of communication. You can hardline that in as the number one important thing from an emergency management perspective.
Especially if you have a mass casualty incident, how many patients you have, how many injuries you have, is that facility overrun with patients? Can they handle more patients? And there's a lot of logistical data that goes into that to help manage that incident. And if you don't have that in place, it can be overwhelming to the hospital.
Because our region faces potential crises year-round, the Bay Area Hospitals Net drills regularly on the air.
Attention all stations on this repeater. This is the Bay Area Hospitals Net.
And in the field.
Kaiser Sanderfeld Medical Center. Kaiser Sanderfeld Medical Center. It's Steve, Kilo 6, Sierra Delta Romeo with the mic.
During an actual crisis, the Bay Area Hospital Net would be staffed by members of Marin RACES, a volunteer emergency radio team coordinated through the Marin County Sheriff's Office.
You know, it's interesting. We actually have 2,000 radio operators in Marin County, and the RACES group consists of 35 of these. So it's really a select group who are committed to public service. There would be a RACES operator in one or several hospitals, and they would be in constant communication with the Emergency Operations Center. And by communication, that's voice, text, and images.
The latest node of the Bay Area Hospitals Net is at the new Marin Health Medical Center, thanks to the engineering work of Marin RACES member Steve Wilson, W6SDY.
And medical staff don't need to know a megahertz from a data packet.
The volunteer operators are communications experts and make sure the Bay Area Hospitals Net is a service to medical teams, not just a technology.
Used across the country, actually, and in California, we don't give enough respect and appreciation to our amateur radio community. But if you were to go to the Midwest, Tornado Alley, or the Gulf states, where they have cyclical, extreme weather, compromising telco infrastructure, and then a few of their local volunteers with some baling wire and an old transceiver get it going again. That's the kind of austere conditions that this net and most amateur radio operations can work with.
Make sure your medical facility or related agency served by the Marin EOC is ready to utilize the Bay Area Hospitals Net in an emergency.